This video is going to focus on the VRpatients authoring tool. So how you can duplicate content that we provide you, make changes to meet local protocols, your curriculum, your hospital policies, or also how you can create a new scenario from scratch. So before we get into it, one thing to note, this is looking at the platform through the clinical sales side. There's also the out of hospital or EMS side. They're very similar. I'll point out the key differences as we go through it, but overall it's a similar experience. So one thing here is you're looking at the library of scenarios, example being chest pain, and you have this duplicate option where I can make a copy and tweak things that VRpatients provided, or we can come down here and build a new scenario from scratch. Both of those will get you into the authoring tool, which is what we're looking at now. And really from here, we're just going to work down this left-hand side to build our scenario. So first thing is getting a scenario name in. Then we can choose how long we want the scenario to run, what avatar, different voice options, so different tones, different accents, male, female options. The scenes, so we could play this out in one scene, say for clinical, we just want to do this in the clinic. For out of hospital, we're going to go from a car wreck to a ambulance. So you can draw that up however you'd like. The next tab says transfer of care for clinical. For EMS customers, it's going to say dispatch report. It's really the only difference there. This is where we're providing any pre-briefing information to the learners. So what we want them to know before they start the scenario. Easy example could be you are presented with a 65-year-old has 2 hours of chest pain. Put as little information in there as you want. Over here on tags, this is how you can organize your scenarios. So you can apply these and sort through them in the library. The outcomes, anything you want the learners to focus on. Same with learning objectives. So we could put in here, that's what they should be focusing on in this scenario. And then the scenario path is how one instructor can communicate to another instructor on what they built. So you can get a quick high-level overview of what was created before assigning it out. The patient conditions is how the patient is going to start the scenario. So we have them seated forward. The behavior, so these are all different animations. You can see holding their head, distressed breathing, whatever you want to focus on. So let's do holding their head. Large library of different waveforms. We can change any of these vitals here that we want. The chest sounds, so open that up. Different lobes, so we can throw some wheezes in here. We could go posterior if we want. And then we could also change the heart sounds. And then the mannequin over here, so we have over 2,500 different moulage options. So you just click where you want to apply moulage. So let's say on the head. And we want to apply this abrasion. And I click another body part, lower right arm. If I click these drop downs, you can see different options here. And then we can apply this contusion. So you can draw that up however you want throughout the body. The pen light is, again, if this was a head trauma, the left eye is dilated and now it is non-reactive. The dialogue, so the legacy VRpatients authoring tool, you typed out what questions you wanted learners to have access to and then canned responses. But now we can toggle on AI patient dialogue. You can free text any information you want the patient to know about themselves. You could always use something like ChatGPT to build you a patient story, copy and paste it here. Use ones that we've already put in the platform, or we have templates. So some examples here, a headache, I apply that. I can read through this, make any changes I want, add information, delete information. Easy example. And now this patient, if asked, knows they are from Cleveland, Ohio. Also, you'll see up here a call option. So if we want the learners to communicate to, say, a physician, a pharmacist, a respiratory therapist, you can add those on and then build out dialogue for them. One other option you'll see in here, listen for, say this, and that is where you can kind of put guardrails on AI to say when the virtual patient hears, what are your allergies? I want every time the virtual patient hears that question, I want them to say, why don't you just help me already? And reason for this, we got to keep AI on track. You are agitated. So anytime a learner asks that question, this is going to be the response. So that's how you can kind of standardize the dialogue if you'd like to. Custom menus, where we can build out in-scenario quizzes, multiple choice questions. So easy example again, where would you take this patient? Say for like the EMS folks at the car crash, where are you going to take this patient? You could type in your actual name of the local hospital, the freestanding ER, the trauma center, whatever you want them to have a choice at. Another example would be, what heart rhythm are you seeing? And then list out different rhythms and we can see what they choose. The IVs, what locations they can place IVs, what gauges they can choose from. Also, do they have access to an IV pump? And then you can set up a virtual IV pump as well. The medications, so we just toggle them on and now they're available. And then I'll show you down here in scenario logic how we set up when albuterol is given, what it'll do. When aspirin is given, what it'll do. There's also fluids here. For the out-of-hospital EMS, there'll be less options on fluids, but it's all the same setup besides that. And then you can see here, you can create a new med or a new fluid if there's not one listed. Oxygen, what oxygen the learners can apply. Interventions, so I toggle it on. They can now place this patient in a C-collar if they want, and they can apply direct pressure. You see some grayed out. If I went to the moulage again and I applied something like a gunshot wound, then the tourniquet would be available and we could turn that on. So some of those are tied to specific moulage. The procedures, so can they start CPR? What PPE can they choose? And then two other procedures down here. Monitors, what leads? Can they put them on pads, order a 12 lead, pacing, defib, sync, and what monitor will they have access to? The chart, so out of hospital, this will say media, and the main difference is out of hospital, you have access to 12 leads as well as images. So you can open up your files on your computer, put a picture of your local protocols. Example for 12 leads here, I drop in a 12 lead and now that's available to learners. For clinical, you can see there's a lot more options. They can drop in picture of lab results, medication orders, physician orders, protocols, hospital policies, anything you want them to reference throughout the scenario. The grading tab, so if I turn on AI dialogue assessment, it opens up this box. And just like dialogue, I can free text what I want their soft skills to be evaluated off of. And there's also some standards that we already have in here. So I drop this one in. And now any of the soft skills, the communication, will be evaluated based off anything in this box. Learners will get that report at the end of the scenario as well as the instructors. If you wanted to tie points to specific interventions, so did they put the patient on a nasal cannula? That's needed here. And if they do it, they get 1 point. So you can go through the whole rubric and assign points to anything you want. Lastly, as the platform is self-directed, it's an asynchronous setup, you need to drop in these nodes. So here's a action node, meaning when the learners give a medication, when they provide the patient with oxygen. So example could be when the patient is put on nasal cannula. The effect, so I right click, it opens up this option for me. The effect of nasal cannula is going to be a change in, and you can see all your options here. We want to change the vitals. We want to change the SpO2 by 4 and do that over 60 seconds. And I tie those together, and I just programmed when the patient's put on nasal cannula, the SpO2 is going up by 4 over 60 seconds. Two other quick ones to know is there's a timer if you wanted to throw any delays between something happening, and there's also a check. So we could say, all right, they put them on a nasal cannula. We want to make sure that the correct rate. If it is, we're going to go this way. If it's the wrong rate, we're going to go this way. So you can get very complex with this if you want, or you could just leave it very high level. So once you get your scenario built out, you can always test run it down here. So we'll take a look at what we just built. We should see our pre-briefing information. So there's that information I typed in, a learning objective. You should see the abrasion on the head, a contusion. He's holding his head. We should see the 12 lead I put in. And if I ask him a question, and I could talk or I can type this out on the web version.
I'm from Cleveland, Ohio.
And there he stated he's from Cleveland, Ohio. So that shows you high-level overview of how to build your own content. Again, you could make these very simple, very complex, just depends how much time you want to put into it.